I'm a doctor. I was trained to believe that I decided the healthcare system. I told you when you needed surgery, when and how you deliver your baby, and whether or not I needed to withdraw care. The old way was I was the one that performed healthcare upon you. Not anymore. You have choice. With technology, you are able to figure things out yourself. And you have access like never before. Other industries have figured out this well, to give users access. And we need to embrace this choice. This is my vision for healthcare. As healthcare providers and leaders, we need to give up absolute control over healthcare. And you, as individuals, need to take control of your health, of how health is delivered, and how the healthcare system and technology can enable us. Now, don't get me wrong. I don't want to expect everyone to be a doctor, nor should you. I know when I'm needed for trauma, heart attack, broken bones. But you all have skills that I don't have in business, engineering, technology, leadership, and passion. And we urgently need those skills. Let me explain. When the iPhone came out, it was revolutionary for a number of reasons. But the most important thing was its open development platform. What that means is all of us with a great idea can develop an app and have it placed on all of our iPhones. We need an open development platform for healthcare. I can treat people with cardiac arrest. However, the most important thing for cardiac arrest is early CPR. This app, used in the United States, notifies registered users when they can perform CPR and where they need to go right away, earlier than paramedics, before physicians or nurses. Just one example. You own your health. My mother-in-law saw her physician a few weeks ago, who's excellent, by the way, and came away from that visit not knowing her diagnosis, her treatment, or her plan. I asked her to go back and get her medical records, to which she was stunned because she didn't think she could. You can, she can. We all own our health. And now with technology, you do have it at your fingertips and in your hand. You can get your lab test results, x-ray reports, specialist consults. Using that with friends and family and the internet, you can meet and discuss with your healthcare provider, and we can all come to a shared plan to improve your health. But as those of you who are healthcare providers, we have to avoid being barriers to access. For 16 years in healthcare, I've seen where the healthcare system has prevented you from having your information. When my mom was dying from cancer, the physician provided us open access to all her information, which empowered us and gave us a better chance to understand. And I expect that for everyone. Retailers currently do it better than we can in healthcare. From your purchasing habits and other data, they can predict whether or not you're pregnant or not. From whether or not you buy lotions, creams, vitamins, household items, they can tell you if you are pregnant and when you'll deliver. Imagine if we had that for healthcare. But you can take control of your health right now. You can monitor your diabetes, your blood pressure, exercise, and sleep cycles. You can look at asthma and prevent asthma attacks from pollen counts and pollution levels. You can look up risk factors. You can even know your genetics. I spat into a jar and sent it to a lab, and this is what came back. I now know all my genetic risks. I know my drug sensitivities and susceptibilities, and I know my heritage. In addition to having a higher than average Neanderthal DNA, I know my risks, and I've altered my lifestyle to reduce my risks. Currently, there's a lot of things in healthcare that are showing great changes. Fraser Health earlier this year had a hackathon where programmers and healthcare providers came together to solve health. But we don't need innovative technologies or fancy work. We just need passion and commitment. This is my son, Kenta. He's 10. He and his grade 5 class on Maker Day were given the task to develop something that would help people with disabilities. So with cardboard, tape, and pens, they put together Cast Aid. On the cast, there are sensors that detect what type of injury it is and how it can move. Linked to an iPad that's also linked directly to a therapist live, therapist is able to direct their rehabilitation and say what they can and cannot do. With virtual reality glasses and gaming, of course, because he's 10, You're able to stay active and involved as you heal from your injury. This shows anyone can be an innovator. But we don't need fancy or expensive technologies to innovate. Sometimes as healthcare providers, we just need to step aside and let others lead. And in the case of the opioid crisis, this is where we gave the public an antidote, and it saves lives. We are all innovators. You as business leaders, politicians, teachers, educators, parents, children, all have great ideas that we need for healthcare. And those of you who are healthcare providers, open the doors. Have an open development platform for healthcare. If we embark upon this, though, there is caution. There will always be witch doctors and snake oil salesmen who will try and take advantage of us. There will always be issues with privacy, and so all of us need to be shepherds of the healthcare system and be careful and to watch out for each other with quality. But this is my vision. As healthcare providers and leaders, we need to give up absolute control over healthcare. And you as individuals, patients, and families, take control of your health, of the health delivery, and of the healthcare system. And together we can achieve our goal of health. Because truly, what else is there other than health? Sure, money, cars, travel, time, leisure, it's all important. But nothing's more important than health. As a healthcare provider, you have skills that I don't have, and I need your help. Let's work together. Thank you.